We've heard a lot about how chronic conditions like diabetes or hypertension can lead to even worse outcomes from COVID-19. We're getting some expert advice this morning on managing those conditions at home from Dr. David Houghton, the Medical Director of Digital Medicine for Ochsner Health. Good morning.
Good morning. Thanks for having me, Meg.
Thank you for your time. All right, so first, Dr. Houghton, can we just talk about, in broad terms, how critical is digital medicine or telemedicine right now during this pandemic?
That's a great question. When we started planning for this pandemic now 4 months ago, we knew that there was a unique opportunity to try to protect some of the most vulnerable patients in our community. The early data suggested that the elderly folks, people with diabetes and hypertension as chronic conditions, were going to be the ones that may have a more severe course of illness with COVID-19. So we worked hard to set up more aggressive telemedicine programs, those forward-facing visits to be able to see the doctors that you know and trust, as well as our digital medicine programs to help manage diabetes and hypertension with remote monitoring at home.
So specifically that diabetes and hypertension program that Ochsner launched, how does it work, the digital medicine program?
Sure. So we've had this program in place with the work of our Innovation Ochsner team for more than 5 years now, and it's an opportunity for our patients to be able to work with a health coach and focus on things like their lifestyle changes, exercise, dietary choices, as well as working with clinical pharmacists. These are doctorate-level clinicians to help put them on the perfect medications for them and really tailor a program for them. It's all managed with Bluetooth technology on their mobile phones or other mobile devices, and they're given, as part of the program, one of those blood pressure cuffs that connect through Bluetooth or a glucometer to help manage their diabetes at home.
I mean, it's pretty amazing when you think about it that this is able to be monitored from home just to kind of reduce the number of in-person visits. It's pretty amazing technology nowadays.
Absolutely. We realize with these programs that the data is the key. The average patient might see their primary care physician 2, 3, 4 times a year. They may check their blood pressure periodically in between visits, but we know the patients in our program are checking their blood pressure or their blood sugars 2 or 3 times a week at minimum, and sometimes 2 or 3 times a day. That gives us the opportunity to really work hard at making the right decision more quickly and treat the patients right where they are.
So how big is the program? I mean, is it just, specific to New Orleans or this region?
We have more than 11,000 patients that have been enrolled in it now, and there's been a wide push, particularly during the COVID pandemic, to increase that, and there are more than 3,000 patients right now that are as part of the onboarding process, getting introduced to their health coach who's going to help them with those lifestyle modifications, getting introduced to their clinical pharmacist that's going to help manage their medications. We have it in Louisiana, Mississippi. We just recently launched in Florida, and we will have more states, particularly across the Gulf South, by the end of 2020.
Wow, that's pretty expansive.
We realize that there's so many patients that really could use the assistance of a program like this so that they can shelter at home and monitor in place and avoid all the risky places that have become more evident right now during COVID-19. And even after the pandemic, we realize that this is really the right way to treat blood pressure and diabetes. In our hypertension program, for the hardest to treat patients, we've been able to improve their blood pressure management 3 times what we were able to do before they were in the program. That's triple the control. That's amazing stuff.
Yeah, that really is. All right, Dr. David Houghton with Ochsner Health, thank you so much for your time this morning. We appreciate it.
Thank you very much for having me, Meg.
Take care.